My name is Jean Claude Mbanya. I'm Professor of Medicine and Endocrinology at the Faculty of Medicine and Biomedical Sciences of the University of Yaoundé, Cameroon. I've been dealing with diabetes since 1990, so you understand that I've been in the diabetes field for a long time. I have seen people dying from type 1 and type 2 diabetes because of lack of access to medication, to medical treatment, to care. In sub-Saharan Africa, diabetes, especially type 2 diabetes, has emerged as the most important cause of morbidity and mortality. This is a region where in the early 60s, they said diabetes was rare. But nowadays, diabetes is so common that you see it everywhere on the continent. In fact, if you look at the IDF Diabetes Atlas of 2019, you see that the projection of sub-Saharan Africa is exponential if you think that diabetes would increase from 19 million to about 47 million from 2019 to 2045, which is an increase of 143%, which is the region with the greatest increase in the world. I think part of the hypothesis, what is happening is that as we have embraced economic development in sub-Saharan Africa, we've lost some of our cultural norms. That is walking, riding. We didn't used to have cars. We used to walk on foot. Diet was mostly not refined carbohydrate. Things have changed now. So we've changed the way we live. We've changed what we eat, and then we are physically inactive. I think if you live on the continent where there is no social insurance or health insurance system, where the patient has to pay for their drug, even when you have chronic disease like diabetes, then the situation is alarming. Why do I say alarming? Because in type 2 diabetes, for example, you need the tablets, you need monitoring, and then you eventually need insulin. And if you think about the modern treatment, which are the oral drugs and some injectables, they are not found everywhere. In fact, in most sub-Saharan Africa, they depend on generic drugs. That does not mean that some people cannot afford it. There are rich people there who can afford best drugs. But there is also the problem of accessibility. If you live in a rural village, which is 400, 500 kilometers from the center, it's difficult for you to have the best drugs. We know that type 2 diabetes is about 80-85% of the general prevalence of diabetes. So most of the people with diabetes in sub-Saharan Africa have type 2 diabetes. We would have all the generic drugs like metformin, like sulfonylureas, they are present in most places, but access to new medication, new proven medications, which would reduce morbid mortality in type 2 diabetes are uncommon because the patients cannot afford it or the governments cannot procure this type of drugs with their meager health budget. I think if you take the rest of the 15%, about 15-18% who have type 1 diabetes, and I must say that type 1 diabetes, you need insulin for life. If you don't have insulin, you are going to die. This is the most crucial part because we know that so many children are dying in Africa because they lack insulin. And this lack of insulin is more prominent, especially in the poorer couche of our society, where people cannot pay for the medication. In sub-Saharan Africa, we have a two-tier system. One, which is the infectious disease system, where it's fully funded. A patient with an infectious disease like HIV/AIDS has everything at their disposal and free medication, free tests. But if you have a non-communicable disease like diabetes or high blood pressure, if your family cannot pay for your medication, for your treatment, you are going to die because there's no universal health coverage for those two diseases. Something has to be done to reverse the situation when we have one healthcare system taking care of everyone in our communities. I think one of the important things in the history of diabetes is the development of insulin about some 100 years ago. How many people really still benefit from that discovery? Part of the problem in the 1921 is that children, especially with type 1 diabetes, were dying because of lack of access to insulin. Has the situation changed in Africa? Slightly, but People and children are still dying because of lack of access to medication, insulin, and other diabetes supplies. So 100-year anniversary of insulin should mean that we should have universal access to insulin. This is a drug that can be manufactured. It's complex, yes, I know, but there can be international solidarity to ensure that those who need insulin have the insulin wherever they live in the world. If you live in a high-income country and you have insulin and people are dying in low-income countries because of lack of access to insulin, what are we celebrating? 100th anniversary of insulin for the rich or for the poor? What you need is international solidarity. International solidarity like the one we had in HIV/AIDS, where the World Bank, governments, private sector, donors, WHO all came together to procure medication for HIV, and today HIV has been transformed into a chronic disease. Why can we not do this for diabetes, especially type 1 diabetes, access to insulin, as we're discussing the 100 years of the discovery of insulin?